wrist, and I need to perform a HOPS evaluation to try and identify the problem. HOPS stands for history, observation, palpation, and special tests. Let's get down to business. First, I need to check that the scene is safe. In this situation, it is. There are some questions you need to ask when approaching an injured athlete to get the past and present history. Ask them how the injury happened. What were you doing? Where does it hurt? Have you had the injury before? What kind of injury? What was done to fix it? Do you have any radiating pain up your fingers or down your arm? Can you duplicate the movement on the non-injured side? Did you hear or feel any pops, snaps, or cracks? These points of these past and present HOPS questions are to determine the history of the injuries the athlete has had in the same anatomical place. The next part of our evaluation is the O, or observation segment. The evaluator should be observant of various signs. These signs include
discoloration, swelling, deformities, joint position, and soreness.
Now I have to look at your hand and wrist to see any signs of injury. I'm checking to see any observable discoloration, swelling, deformities, and checking joint position if you're experiencing any soreness. The next step of the evaluation is the P, or palpation segment.
What are you going to palpate?
I'm going to palpate the bones, muscles, ligaments, tendons, and joints of the hand and wrist to see if there are any abnormalities. I'm going to start with the bones of the wrist, with the scaphoid at the anatomical snuff box. Then, moving medially, I will find the lunate, the triquetral, and the pisiform. In the next row, the more distal row, I will find the trapezoid, trapezium, capitate, and hamate. Next, I'm going to palpate the bones of the hand and fingers, starting with the metacarpals, metacarpal 1, thumb side, 2, 3, 4, and 5. Next, I'm moving on to the phalanges. All phalanges except the thumb have 3 bones in them: the proximal, the middle, and the distal phalange. Between these bones, there are very important joints: the DIP, or distal interphalangeal joint, the PIP, or proximal interphalangeal joint. Next, I'm moving on to the muscles of the wrist. The flexor group has some important muscles in it, such as the carpi radialis, the carpi ulnaris, and the palmaris longus. Next, the extensor group, with the carpi radialis longus, the carpi radialis brevis, and the carpi ulnaris. These wrist muscles help to perform 4 movements: wrist flexion, extension, and radial and ulnar deviation. Next, I'll be moving on to the movements of the fingers. There are 4 movements there as well: finger flexion, extension, abduction, and adduction. And the thumb has special movements of its own: thumb opposition. Alright. As the evaluator, I will now use a series of special tests to determine the origin of these athletes' injury. The first test I will do is the percussion test. The athlete is sitting with the injured finger extended. I put an axial load at the tip of the finger, and if the pain radiates down the finger, it could be a possible fracture or dislocation. The next test is the compression test. I will squeeze the phalanges for a possible fracture, and if the pain is there when I squeeze it, there is a fracture or dislocation. The next test I have to do is the Finkelstein test. The athlete is sitting and forms a fist around the thumb. The examiner will then grab the fist and the forearm and ulnarly and radially deviate the wrist. This is looking for laxity in the wrist and possible fracture of the scaphoid that would cause crepitus in the deviation. The next test is Fallon's test, where the athlete is sitting and maximally flexes the forearms for a full minute. This test is to check for carpal tunnel syndrome. After the minute is passed, the athlete will release the hands, and if there is tingling down the fingers, it is a positive sign for carpal tunnel syndrome. The next test is also a carpal tunnel test called Tinel sign. The examiner will tap the carpal tunnel, and when the impact is received, if there's a positive test, it will shoot pain and tingling sensation down the fingertips. The next test I have is Murphy's sign. The athlete will make a fist around the thumb, and I, the examiner, have to look at the lineup of their knuckles. If the third metacarpal is dropped, one thing we forgot, actually two things, are valgus and varus tests. These can be performed at the distal interphalangeal joint, the proximal interphalangeal joint, the metacarpal phalangeal joint, and the wrist. Thank you. Have a good night. One thing we forgot, actually two things, are valgus and varus tests. These can be performed at the distal interphalangeal joint, the proximal interphalangeal joint, the metacarpal phalangeal joint, and the wrist. Thank you. Have a good night.